Hi, my name is Anthony Watson, and I'm representing ACE Healthy Products in collaboration with Dayton Montgomery County Public Health to provide to you today COVID-19 vaccination education. What is COVID-19, also known as the 2019 novel coronavirus or COVID-19? It's an infectious disease that had not been previously observed in humans. Keep in mind, there are several coronaviruses, but this is a new one. COVID-19 spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. How do we prevent COVID-19? We can prevent COVID-19 by washing our hands regularly with soap and water, maintaining at least 6 feet of distance between yourself and others, wearing a mask or face covering when in a public or around others, avoiding large crowds and gatherings, as well as limiting unnecessary travel as much as possible. Symptoms of COVID-19 can appear between 2 and 14 days after exposure to the virus. With the Delta variant, we are able to see these symptoms earlier on, but generally speaking, you will get symptoms within 2 to 14 days after being exposed to the virus. These symptoms can include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, or congestion. So why is the COVID-19 pandemic considered a crisis? The coronavirus has killed more Americans in 2020 than any cause of death in 2019 other than heart disease and cancer. In fact, in terms of fatalities, it has surpassed the 1918 Spanish flu. COVID-19 has exacerbated socioeconomic disadvantages and has impacted the global economy. On top of all of that, without global vaccination, the end of this pandemic is nowhere in sight. This means that variants will continue to evolve more and more over time. This global pandemic has also shown crisis within a crisis in the health disparities it presents. Long-standing systemic health and social inequities have put many people from racial and ethnic minority groups at increased risk of getting sick and dying from COVID-19. Some factors that contribute to increased risk include discrimination, healthcare access and utilization, occupation, education, income, wealth gaps, and housing. Another crisis within this crisis is the negative impact the pandemic has had on mental health. This pandemic has changed how we socialize and interact with people and has caused an increase in mental health disorders. The COVID-19 pandemic and the resulting economic recession has negatively affected many people's mental health and created new barriers for people already suffering from mental illness and substance use disorders. In 2020, about 4 in 10 adults in the U.S. have reported symptoms of anxiety or depressive disorder, which is an increase from the 1 in 10 U.S. adults that had reported this from January to June of 2019. In our presentation today, we would like to define for you certain terms you may have heard within the past year and a half regarding the pandemic and the COVID-19 vaccinations. An antigen is a toxin or other foreign substance which induces an immune response in the body. An antibody is a blood protein produced in response to and counteracting a specific antigen and combines chemically with substances the body recognizes as alien. Immunity is the protection you get from an infectious disease. If you are immune to a disease, you can be exposed to it without being infected. A vaccine is a product that stimulates a person's immune system to produce immunity to a specific disease, protecting the person from that disease. Vaccines are usually administered through needle injections, but some can also be administered by mouth or sprayed into the nose. Vaccination is the act of introducing a vaccine into the body to produce immunity to a specific disease, and immunization is a process by which a person becomes protected against a disease through vaccination. This term is often used interchangeably with vaccination and or inoculation. Before we talk more specifically about the COVID-19 vaccine, let's go back to the basics of vaccine. A vaccine stimulates your immune system to produce antibodies exactly like it would if you were exposed to the disease. After getting vaccinated, you develop immunity to that disease without having to get infected with the disease first. This is what makes vaccines such powerful medicine. Unlike most medicines that treat or cure diseases, vaccines prevent them. Some vaccines contain the same germ that causes disease, but they have been either killed or weakened to the point that they don't make you sick, whereas other vaccines contain only a part of the disease germ. In some instances, antibodies can be transferred from mothers to their babies without also provide certain levels of immunity to the child. Before a vaccine is ever given to people, the U.S. Food and Drug Administration or the FDA oversees extensive lab testing of the vaccine. Once a vaccine is licensed, FDA, CDC, NIH, and other federal agencies routinely monitor its use and investigate any potential safety concerns. Now that we have reviewed the basics of a vaccine, you are probably asking yourselves, how do the COVID-19 vaccines work? The different types of vaccines work in different ways to offer protection, but with all types of vaccines, the body is left with a supply of memory T lymphocytes as well as B lymphocytes that will remember how to fight that virus in the future. It typically takes a few weeks after vaccination for the body to produce T lymphocytes and B lymphocytes. Sometimes after vaccination, the process of building immunity can cause symptoms such as fever. These symptoms are normal and are signs that the body is building immunity. When speaking of the COVID-19 vaccine, there are two types, the mRNA vaccine and the vector vaccines. Our mRNA vaccines are the Pfizer and the Moderna. They use messenger RNA or mRNA, and basically these proteins are inserted into the body in the form of a vaccine and trigger your immune system to create antibodies against the virus. The important thing about this slide in the presentation is that it shows that the mRNA vaccines are safe. There are a lot of misconceptions about these vaccines, but we can see here that the mRNA in this type of vaccine teaches your cells how to make copies of the spike protein on the coronaviruses. This type of vaccine is made of mRNA wrapped in a coating that makes delivery easy and keeps the body from damaging it. If you are exposed to the real virus later, your body will recognize it and know how to fight it off. This being said, when your body is exposed to the vaccine, it can sometimes cause a mild fever, headache, or chills. This is completely normal and a sign that the vaccine is working. After the mRNA delivers the instructions, your cells break it down and get rid of it. The vaccine does not contain any virus, so it cannot give you COVID-19. It also cannot change your DNA. The other form is the vector COVID-19 vaccine, which is the Janssen & Johnson vaccine. It is a weakened form of the virus that triggers the immune system to create antibodies in the same way that the mRNA does. It's older technology, and we have been using this kind of vaccine for many years. These vaccines don't harm you, but instead create an immune response in your system to help fight off the virus. This slide shows us that a viral vector vaccine uses a harmless version of a different virus called a vector to deliver information to the body that helps it protect you. When your body responds to the vaccine, it can sometimes cause tiredness, headache, muscle pain, nausea, or mild fever. These are normal signs that the vaccine is working. The vaccine does not contain the virus that causes COVID-19, so it cannot give you COVID-19. It also cannot make you sick from the virus that is used as the vector. It also cannot change your DNA in any way. Let's discuss the three different types of COVID-19 vaccines that we have in the United States. The Moderna COVID-19 vaccine is an mRNA vaccine that requires 2 shots. The second dose of the Moderna vaccine is received 28 days after the first dose. The Moderna vaccine has been shown to be 94.1% effective at preventing laboratory-confirmed COVID-19 illness in people who received 2 doses. The Moderna COVID-19 vaccine has gone through a lot of clinical trials that had approximately 30,000 participants. Of these participants, 79.4% were white, 20% were Hispanic, Latino, 9.7% were African American, 4.7% were Asian, and less than 3% were of other races and ethnicities. The Pfizer COVID-19 vaccine, like the Moderna, is an mRNA vaccine that requires 2 doses. The second dose is received 21 days after the first dose. The Pfizer shot has been proven to be 95% effective in preventing the laboratory-confirmed COVID-19 illness in people who receive 2 doses. In the Pfizer COVID-19 vaccine clinical trials, there were around 43,000 participants. Of these participants, 81.9% were white, 26.2% were Hispanic, Latino, 9.8% were African American, 4.4% were Asian, and less than 3% were of other races and ethnicities. The Johnson & Johnson Janssen COVID-19 vaccine differs from Pfizer and Moderna because it is a viral vector vaccine, not mRNA. It only requires 1 dose that has shown to be 66.3% effective in preventing the laboratory-confirmed COVID-19 illness in people. During the Johnson & Johnson clinical trials, they had approximately 40,000 participants. Of these, 62.1% were white, 17.2% were black or African American, 8.3% were American Indian or Alaska Native, 5.4% of participants represented multiple races, 3.5% were Asian, and 0.3% were Native, Hawaiian, or other Pacific Islander. Amongst different ethnicities, 45.1% of the clinical trials were Hispanic Latino. A booster shot is another dose of a vaccine that is given to continue to resist infection by keeping immunity strong. The COVID-19 vaccines work well at preventing severe illness, hospitalization, and death. Overall, the booster shots will help to keep them working effectively. The benefits of a COVID-19 vaccine far outweigh the risks of not receiving it. None of the COVID-19 vaccines contain the live virus that causes COVID-19, so a COVID-19 vaccine cannot make you sick with COVID-19. COVID-19 vaccination will help keep you from getting COVID-19, and evidence show that getting a COVID-19 vaccine may also help keep you from getting seriously ill, even if you do get COVID-19. Another benefit of getting vaccinated is that it also protects people around you, particularly people at increased risk of severe illness from COVID-19. As you know, COVID-19 can have serious life-threatening complications, and there's no way to know how this virus will affect you. And if you get sick, you can spread the disease to friends, family, and others around you. Finally, there have been no links found between vaccination and deaths. The COVID-19 vaccinations will be an important tool to help stop the pandemic, but not by itself. Wearing masks and social distancing will still be pivotal in helping to reduce your chance of being exposed to the virus or spreading it to others. The combination of getting vaccinated and following CDC recommendations to protect yourself and others will offer the best protection from COVID-19. Get in touch with us. If there is any information you need to know more about COVID-19 or the vaccination, you can always go to the Montgomery County Public Health Department website, which is listed here. We also have listed here specific websites about general COVID-19 information, vaccine information, and even insight on our COVID-19 minority outreach. Also listed here are the hotline numbers for the public health, which is 937-225-6217, and the Ohio Department of Health, which is 1-833-427-5634. We hope that more and more people will realize the importance of getting vaccinated and continuing to wear your mask, washing your hands, social distancing, and all the other things that CDC recommends to continue to protect ourselves and our community against the coronavirus. Thank you very much.